Hey, Emily. I wanted to chat with you about electrolyte disturbances. They seem to be cropping up more frequently lately.
Absolutely, Dr. Patel. Electrolyte imbalances can have significant implications for patient health, especially in the hospital setting.
Exactly. I've been seeing a lot of patients with hypokalemia and hyperkalemia lately. What's your take on managing these disturbances?
Well, for hypokalemia, it's essential to identify and address the underlying cause while replacing potassium to correct the imbalance. Monitoring renal function and adjusting medications that may contribute to potassium loss is key.
Makes sense. And what about hyperkalemia? That seems to be trickier to manage.
Definitely. Hyperkalemia can be life-threatening, so it's crucial to take prompt action. That involves removing excess potassium from the body, stabilizing cardiac membrane potential, and treating the underlying cause.
Right. I've been using a combination of dietary restrictions, medications like loop diuretics and potassium binders, and sometimes even dialysis in severe cases.
That sounds like a comprehensive approach. It's important to individualize treatment based on the patient's clinical status, comorbidities, and the severity of the electrolyte imbalance.
Absolutely. Collaboration between physicians and pharmacists is essential in managing electrolyte disturbances effectively and ensuring the best possible outcomes for our patients.